last thing any any of us want to hear is that the cost of X is getting ready to go up again. And unfortunately, I'm the one that is bringing the news that your healthcare coverage through your employer is getting ready to go up, and it's almost good possibility it could be double digits in the increase. Folks, I mean, I'm with you here. This is, I mean, in the last 3 years, let alone five. Let's just say in the last 3 years. I mean, we have had on average inflation has been between it feels and it's showing up in the grocery store around 25 to 30% just to feed the families. Let's take beef prices and poultry prices out of there because that's been its own weird bubble due to things. But still, it still costs, right? That cost is still there. So the last thing we want to hear is that okay, now healthcare for my family is now going to cost more, and it's just frustrating, and it's something we're going to have to deal with in 2026. There's reasons behind it which we're going to get into. We're going to look at what the expected percentage increase is going to be for the employers. Again, why there's reasons that none of us really care, right? I mean, to be brutally honest on this, none of us really care why things are going up, and I think we all know a big portion of it is the reason the prices are going up is because they can raise them. It's healthcare. What are we going to do? There's things we're going to cover that you can do as an employee. There's options to be able to try to maximize your capital where it can go. And ultimately, we're going to take a look at what employers can do. And what my clients are doing to try to mitigate these costs. But also, they're going to have to make some decisions that, frankly, they aren't happy about as employers. And we'll get into that in a little bit. So for those that don't know, my name is Ryan Howe. I am a business coach, works out of West Michigan, around the country. I come on YouTube just sharing information I share with my clients, and I hope to earn your subscription. So let's get into this here. Links, as always, are going to be in the description. Now, this is something that my clients and we've been planning for a while. It's just we knew this was coming because the industry was dropping hints, and they've been letting us know since around March, April timeframe that more than likely this was going to occur for reasons outside of the normal political sphere. However, we're going to say tariffs is one of the reasons. It's there, right? Tariffs has some effect on this, but mostly they're raising prices for reasons we're going to get into. So let's see what we got here. So employer-sponsored health insurance plans are about to see the biggest increase in costs in 15 years, and companies are bracing for impact, according to Mercer's National Survey of Employer-Sponsored Health Plans. Total health benefit costs per employee is expected to rise by an average of 6.5% next year. Even after employers take steps to control expenses, if they made no changes, costs would climb closer to 9%. And that's on average. That's a very, very important thing here. This would be the average. There are plans and there are packages that are going up by upwards of 15%. There's others that are going down, maybe you own 4 or 5%, but you're burdened more so with as the employee on that stuff. So this is, that happy medium mix, and one version of this. We're sitting at 9% as the average. Ladies and gentlemen, take what you pay currently for your healthcare, right? That you pay for your premiums, and you do the math on that, and that is not a small dollar amount that's going to be affecting American families. Now, the steepest projected increase since 2010 and the fourth straight year of above average growth, following a decade of moderate 3% annual gains. Inflation cooling in other parts of the economy. What? Because gas prices are down? The economy's cooling because the gas prices are down. No. We go to the grocery store. You tell me. You tell me if they're down in the other parts of the economy. But many employers had hoped for relief on health costs, but there was that they hoped, but man, that was not going to happen. That was never the case. Now, the cost spike has become a call to action, prompting 59% of employers to implement cost-cutting measures for 2026, up from 48% from last year. So about half had to cut costs in order to make this happen. Now, you've got an additional, give or take, 10%, 11% here that are also having to do it as well, too. And by the way, when they're cutting costs, that means that they are also not spending in the economy. Like, these are all things that are happening. This is real negative downward pressure on the economic engine in on the country, because costs of healthcare are going up, and we kind of need to be healthy. It's a thing, right? We like to be alive. So let's see here. So why health benefit costs are poised to jump, and what employers are doing. So behind the rise are two main forces, and this is very clear: higher prices for healthcare services. There is having to do cost of living adjustments. There is also, and this is another thing here, the healthcare services, the less people who are trained and involved in the actual healthcare industry. It's more and more difficult to find people. It's just less and less. But there's, in the same rate, there is growing rate of utilization, which again they're accelerating at once. So you have the cost of services just in general are going up, and now there's higher utilization, which means, right? Let's go back to basic supply and demand curve there. If the demand is going up, prices are going to be going up as well when you cannot increase the overall supply, which they're limited to. On top of, who here in their area has had a hospital, a clinic, or an urgent care place closed down in the last year, or has been slated to be closed down? Rural Michigan, there's been a couple that have gone down, and then we're looking at throughout the region. You're going to see that as well too. So again, higher utilization, less supply, prices go up. Now that means employees can expect higher paycheck deductions, steeper deductibles, and more limited plan choices as companies search for ways to balance their budgets. Much of the pressure stems from expensive new treatments and technologies, advanced diagnostics for cancer therapies. We got our GLP-1s, right? And gotta have Ozempic. Gotta be using that. Now there's reasons, don't get me wrong, and I'm not knocking what you and your doctor have said, but they're not cheap, and they're being put on to health coverage. Again, but also that's going to be your drive. The pharmaceuticals again are continuing to go up. Look right here. Look at this right here. Strong patient demand for products like Ozempic, which cost an eye-watering $12,000 per year at its list price, have also put pressure on, on the insurance costs, which I always love the name insurance. We all know it's not really insurance. Now, meanwhile, continued consolidation amongst hospitals and clinics right there have given larger health systems greater leverage to negotiate higher reimbursement rates, keeping costs elevated. Employers are responding by shifting costs and rethinking plan designs. Now, I have one client that does cover almost everything for their employees, and then how long that can be a thing for any company, let alone, we're here in rural Michigan. And again, around the country, how long that can be a thing, nobody knows. But those are real costs that are out there, and they're doing their best to try to take care of their folks. That's one of the benefits that they have for compensation. And if this is something that they're dealing with, this is going to take what is a differentiator for them. If they end up having to, not be able to cover everything, it's going to be a net negative effect to their ability to hire and retain staff, right? These are things that we're looking at. Okay, so back out of here. When plan costs rise, the worker's share of health coverage contributions typically rises at the same rate, which means many employees can see paycheck deductions increase roughly 6 to 7% next year. Again, that's if they do nothing. Again, that's on average. Don't be surprised to see a 10% uptick in your, basically in your paycheck deduction. And just think about what that is. That is just wild. All right, so how pandemic contributed medical piece here. We're not really worried about that. This is what we're talking about. I want to get to tariffs. This is one of the things for sure, because outside of what's going on in Washington and all the stupid games and crap that's going on there, tariffs, they exist. And there are tariffs that are on imported goods, and they're not necessarily for healthcare devices, but there are devices that are on the tariff list, which means those prices go up. All right, so again, we're getting to raising prices for materials, medicines, and devices that these systems rely on. This Congressional Budget Office estimates that the current tariff package will lift inflation by an average of 0.4 percentage points. That could not be more wrong if they tried. I would just get rid of that. That decimal needs to move to the right. I would expect to see, we're going to see a whole bunch of percentage, a whole huge percentage increase because of those tariffs. Companies can only absorb those costs for so long, and we're at the point where they can't absorb them anymore. Higher inflation filters into hospital supply chains, benefit budgets, etc., which can add pressure to the overall plan costs. So the American Hospital Association President, CEO Rick Pollock, I think it's Pollock, has warned of tariffs, medical devices, pharmaceuticals, not risk raising costs and creative shortages. They will raise costs, and there will be shortages. Like that's going to happen until we can produce local, in the US, which we'll see if that ever comes to pass. So what can you do? Right? Instead of focusing on the monthly costs, enrollees and workplaces should evaluate full picture of health coverage, including deductibles, co-insurance, out-of-pocket maximums, and the structure of the provider networks. And then some employers are expanding the high deductible health plans paired with health saving accounts, while others are steering workers into narrow tiered networks, blah, blah, blah. I'll put it plain and simple. Those HSAs, if you have the ability to put money into an HSA, you should be using it. Find a way to do it. I know everything else costs a bunch, but whatever you can put into an HSA, just do it. It's one of the rare times that the government has created something that is benefits really just for the individual. It is really, really well thought out, and it's there for you to use. So please make sure you're using that. Now, I don't want to get into the math stuff. Nobody wants to deal with that stuff. Not going to worry about that. Rolling over. Okay. So let's get to this point here. So again, as an employee, you need to make sure that you fully understand all of the benefits that you have with your employer. They have, for each one of your insurance plans, you have the ability to go talk to someone, right? Each one of the providers that are there. I would highly recommend get a hold of your HR, and if that isn't something that they can help you with for whatever reason, reach out to your insurer directly and ask for some help and some guidance on, hey, here's the plans that are in front of me. How did I utilize it last year? And they're going to have an advocate that will spend time with you and figure that out. Yes, they do exist. You have to find them, but they do exist. Same thing. If your HR should be able to help you with that. Now, well, the reason I'm saying do that is because there's a lot of individuals who sign up for Plan X, but really only ever utilize the what would be used in Plan Y, and they end up overpaying. They're not aligned properly because they're worried about missing out on X. When in reality, what I've seen with a lot of folks is that if they go down a tier, and then they may manage a lot of their care through the urgent care instead of going through their PCM, they end up saving a lot more money that way. And it's just, but again, everybody's different. Everybody, the way they manage it is different. So that's why I recommend just go and talk to your HR, talk to an advocate, and do some math. But make sure you fully understand exactly which one you're signing up for, and spend some time to do the math. Now you're going to have, the 1 month to do it, right? Typically when it's, when everybody's coming on and they're signing up for stuff, make sure that you're on top of that stuff, because it could be the difference between, being able to save some money and frankly, you're going to have to dip into your savings to cover some stuff. Now for which again, the guys, I'm not glossing over this. It sucks, but yeah, 6%, a 6% increase is bad enough on average, let alone some of you are going to be dealing with a 10 to 12% increase. It's just not good. Okay. So I'm not glossing over that. Now for my employers, like the folks that I'm working with, this is just where I want to share some of the conversations we're having. And I'm intentionally making sure I'm keeping as vague as possible, just to make sure that nobody can, put a pin in it exactly who's who. For employers, right now, hiring is a huge pain. It is just a pain out there in order to get people to attract talent, right? To be able to attract that talent, to retain that talent. And through wages alone may not be enough. What you should be looking at is also with your healthcare coverage. How can you leverage your healthcare in a way that is going to be beneficial for your current employees, right? You want to make sure taking care of them and is competitive with an industry. Now you should be able to talk to your provider. They're going to give you this laundry list of things on here, but I would advise have a conversation, do some sort of focus group with a collection of your employees. And be like, hey, we're looking at revamping our overall system here. And we're going to be offering here. We don't know everything we can do, and we're still have a limited budget just like everyone else. But we want to hear what you need and see what you can find as far as for utilization, that what people like, what they don't like, and put that into the pool of things to possibly work with your provider, right? The other side of that too is make sure that you're reaching out to your provider for overall utilization averages and rates, and then compare apples and apples and see which one of these actually work best for you. One of the things I've mentioned for my clients, and we've done this in the past, is we've actually limited the number of options for our employees, right? Because if you have more, the chances are that they may end up in one that doesn't actually work for them, work for anyone, and it's something that you've had on the books, which is now when you're looking at the overall math for figuring out how the plans, it eats into the I want to say is here the efficiency effectiveness of your overall plans as a whole. So there may be something for identifying what people would like, what they really enjoy, also getting information on utilization rate, and then narrowing the number of choices down and just say this is why we're doing this, and it's allowing us to keep costs down. uh the last thing that I'm just going to go with here for what my employers are doing as well is we are advertising the fact that we have healthcare is the best within industry where it matters, or we are, in the top percentile for the coverage that we're offering. My advice and what we've been working through for our, for the employees and the companies I work with is to take that, to make healthcare coverage one of the leading factors when we are looking to hire folks and we're advertising for jobs, that we have a top of the line gold standard type healthcare that's available to folks. And for, again, a couple of my clients, they cover everything. They cover everything for the employee and their families. It's not a small bill. It's not a small bill at all, trust me. And so these are things that are touted and put out there and make them competitive within the area. So again, those are things, that's what I'm working with my clients on. Okay. But this is where we're at. Prices are getting ready to go up. We're getting squeezed one more time, folks. They obviously they haven't beat us enough. They're adding another leg down on this. So you got a couple months, folks. Do your homework, do your research, ask the questions, spend time with your HR and with your provider, and do what you can to try to make sure what healthcare you need matches up to the best possible way that you can with some of the coverage that your employer is going to offer. Okay. So with that,